The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul. And today I have Dr. Jared Chapman of Living Well joining us. Dr. Chapman, thanks so much for being here.
Thank you for having me, Shay.
Sure. So the last time you were here, we talked about, of course, these cold, horrible weather, how the skin tends to get dehydrated in
Mhm.
these colder months. And you talked about, I believe it was Revive. Is
Skin
that
V.
the
Skin
Skin Vive?
V.
Sorry, Skin Vive. Okay, Skin Vive, which is a way to hydrate the skin with an injectable. But today
Mhm.
we're going to talk about topical treatments as well, right?
Correct. So Skin Vive is the internal hydrator, the injectable hydrator. It's microdroplet hyaluronic acid going into the dermis. But we need something also to fortify the surface of the tissue and hydrate the surface of the tissue well, and also to fortify the dermal epidermal junction, the barrier that actually protects the skin from dehydration. And one of those things we love to use is a good formulation of hyaluronic acid topically. We have one here called HA5 Hydrocollagen, Revitalize and Restore. It is an amazing product. It has 5 different types of hyaluronic acid, or 5 different chains of hyaluronic acid in it that work differently in the tissue to hydrate short term, hydrate long term, stimulate more hyaluronic acid to be formed in the tissue. Again, it also has things in it that are natural and organic that help to fortify the dermal epidermal junction, preventing water loss from the tissue, which makes the skin appear more hydrated. Um, Patients who use this product notice a significant difference in hydration within about 15 minutes of applying it to the tissue. And then long term use of this product, they can see about a 6 year difference in their skin, saying that their
Wow.
skin appears 6 years younger after using it. So it is a phenomenal product. I do recommend, though, if you don't have Skin Medica's HA5 hydrator, that there are plenty of good hyaluronic acids out there. Just make sure it's from a reputable company, and that it does, has reviews on it that shows that it works. I'm not saying everyone has to use what I have, but hyaluronic acid is a great way to super hydrate the tissue. Also, another thing that we fail to do sometimes in the winter is exfoliate. And we are building up dead skin cells quickly in the wintertime because things are so dry. So the skin tends to desiccate or dry out faster, and it may need to exfoliate a little more frequently during the driest times when we're inside and all that dry heat. Probably a little bit more exfoliation will help allow the surface topicals to get in deeper once we get that dead skin off. So maybe normally we recommend 2 times a week, but maybe we might need to do 3 times a week depending on your skin type and what you tolerate. But I tend to exfoliate more in the winter to try to get that drier skin off faster and allow that topical to get into the epidermal healthy cells and nourish them more. So that's just a couple of things that I would recommend that you do during this time to keep your skin looking healthy and hydrated. Again, there's nothing that replaces really adequately rehydrating the body. And as I preach all the time when I come on here, hydrate, hydrate, hydrate. And it's something that I feel like we get so easily behind on in our day if we're
Mhm.
not really watching it. So, one of the things I will recommend to the public to do is get you a water bottle that's measurable.
Yes.
And then that's easier to keep track of than a cup of water or a bottle of water unless you're refilling the bottle. And I really don't recommend some of the bottles to be refilled. But get a good bottle. I keep a Yeti. It's called a Yonder
Yeah.
bottle. It's 34 ounces. I know if I drink 4 of those a day, I've had adequate water intake, not counting my coffee or tea or anything else I drink. I'm
Right.
talking just water.
Just
Um,
water.
Obviously, if you have issues with fluid balance, such as congestive heart failure or renal issues, you need to discuss that with your doctor first before just doing that. But most healthy individuals need about 100 ounces of water a day to stay well hydrated.
That is great advice. And I do the same thing with my water, taking my water to
Yeah,
work with me. So it's a great
it's
way. All right.
easy to keep track. And then it kind
That's
of
right.
is like a little check mark at the end of the day. I did it. I drank my 4 bottles. So,
That's right. All right, Dr. Chapman, great advice. Thanks so much for being with us.
I'll thank you for having me, Shay.